walking through this life of mine. Well, it's teaching me so many things, like how to love and how to lose and how to choose. Walking through this life.
Well, hello, this is Linda Carbonell from Walking Through Life TV show. Today we have a guest, Wendy Wilton. I told you. Wilton, sorry. So, I'm so bad. They're used to that, me being bad with this. But anyway, Wendy is from Rutland,
yes.
And you're the Rutland treasurer. And she has come today to talk about a very important issue today, which is the Green Mountain Care. And you've done some research and come up and you want to talk about the program Green Mountain Care?
Sure.
Okay.
Linda, thank you for inviting me on
Sure.
your show.
No
It's
problem.
nice to meet you.
Even if I did mess up your name.
Yeah, that's okay.
That's okay. Okay. It'll help you loosen up a little bit.
Thank you for inviting me on the show today. I really want to talk to folks around the state, and I'm happy to come anywhere. So anybody who might see this show today, if you'd like to have me come and talk to a group about what is the fiscal impact of healthcare reform as proposed by Governor Shumlin on the state of Vermont, I'm happy to come to any group and talk to them about that. And what I have done, I started my research about a year ago. I'm a very active member of the Vermont League of Cities and Towns as a town treasurer. And the governor was our guest at our legislative day last year. He came and spoke about his healthcare reform idea. What he said was he wanted to produce a catamount level benefit for all Vermonters that would be funded by payroll tax. And Linda, starting with those two concepts, I thought, wow, this might be a good reform. But since I'm a financial person, I said, I really need to see this on paper for myself. And, my hope was that the administration would start putting together those numbers on what would be the expense of this program versus the revenues and how would it match up, but they have not done that. And they didn't appear to have any interest in doing that anytime soon. And it really got me thinking that if nobody else was going to do that, and the legislature didn't demand it, maybe I could start looking at it. So I started putting together a projection, looking at what are the expenses of this program versus the revenues that are likely to support it, based on what the governor said, and I put that together. I started that work back in March of 2011. I finalized a first projection in May of 2011. I was invited to be a speaker at a healthcare panel about healthcare funding, and I did that. There have been some changes to my projection from May to when I put out the most recent version in October, because it was more that I discovered. I got some internal memos from the Shumlin administration and from Bishka, and I used a lot of information from state resources for this projection about what is the cost of healthcare, how fast is it going to increase, how fast is the Medicaid Global Commitment going to increase? That's another component of the funding. So I was able to find enough information to put together my projection. My major conclusions have not changed, and it is this. This program is going to cost Vermonters a whole lot more than they could ever imagine. It is going to cost a lot more, and the savings that can be found with some streamlining of systems and so on will not be enough to cover the cost increases that are going to occur based on inflation that's happening in the healthcare industry. And so that's going to be a problem no matter what kind of reform the state wants to do. And what I've concluded in my most recent work, that from the time that Green Mountain Care is begun, from its inception for the first 5 years, the state may be on the hook for as much as $2 billion in losses. Now that's a problem. The state budget currently for everything, Linda, is $5 billion. So you can imagine $2 billion, and I'm figuring on average it's about $300 million a year that we'll be losing. That's really hard to find. I mean, think about this right now. The state legislature has been facing some structural deficits in the general fund for the last 3 or 4 years. Somewhere in the magnitude of $20 to $100 million in any one of those last 4 years. They struggle gnash their teeth, wring their hands over finding where do we find this money. Where are they going to find $300 million a year? Because that's what's going to happen here. So I think it's fraught with a lot of issues, and the numbers don't add up for me. There are a lot of people who've been critical of my numbers, saying, hey, we don't know what this is really going to be yet. But, you know, I go back to what the governor said. He wanted to do a catamount level plan. Well, it's pretty easy to figure out what the cost of that is going to be for all covered Vermonters, because we know what the cost of that program is today. And if you apply inflation, it's not hard to figure out where we'd be, say, in 2014 or 2017 on the cost of that program for every one of us. So I wish my numbers were wrong, but I don't believe that they are. The Joint Fiscal Office of the legislature has looked at my numbers 2 or 3 times. I've had some great dialogue with them. They have not been asked to do the same kind of comparison that I've done. So the most recent comments by the chief of the Joint Fiscal Office acknowledged that I've done a pretty comprehensive study here. They haven't done a similar thing. He also said to me, when I met with him last, that if they're asked to do such a study of comparing forecasted revenues to the forecasted expenses, he doesn't think that their conclusions or their structure will be too far off from what I've done. So I've had a lot of validation on this work. My concern is that the legislature has not pursued a similar study for themselves, and that we may be driving toward a program that will lead to a financial disaster for the state of Vermont.
And the programs that you're talking about is Green Mountain Care?
Green Mountain Care.
Being funded through a payroll tax?
Yes.
So
Yes.
if it was to be funded by something else, what could you see it be funded by?
I can't see it being funded by anything
can't s-
else. We need to
So-
raise at least $1.5 billion to support a publicly funded health care plan, even if it only applies to 2/3 of Vermonters, which is what I show in my study. $1.5 billion cannot be found in the sales tax. $1.5 billion cannot be found in the property tax. $1.5 billion cannot be found in some other broad-based tax. So the only place to find this is with a payroll tax. The only place. Right now, with all the property tax that we collect in the state of Vermont, which funds our education fund, is $1.3 billion. So where are we going to find another $1.5 billion? It would mean doubling property taxes. Can you imagine is that feasible?
Yeah, I don't think
No.
that would happen, no.
And think about the sales tax. I mean, I forget the actual number that we raise in sales tax, but it's not $1 billion.
So, well, what did Governor Shulman's plan say that how he's going to pay for it? How they were going to?
There's nothing in the bill that says
Oh.
how it will be paid for.
Oh, there's
there was
nothing in
only his comment, in his verbal comment at the time that I was a guest at this this luncheon, where he said he would go along with Shao's recommendation with a payroll tax. And quite honestly, there's no other place to get it. I agree with the governor on that if you're going to create this system, the payroll tax is the only place to find that amount of money, because it will be expensive. It's going to take the place of private insurance, so that's a heck of a lot of money. I know at the City of Rutland, I'm the treasurer, I'm responsible for monitoring and managing our health care program. A family plan is $22,000 a year for us. That's a lot of money. So we are talking about something that will cost a lot. There's no question about that. I also want to make sure that people who are listening to the show understand that I'm not against reform. I know we need reform, because the trajectory we're on with the current system is not a good one. But I think that there are a lot of other things that we could and should be looking at first as solutions before we launch into a single-payer system completely funded by tax dollars, completely under control of the state, with the possibility of having cost and taxes be completely out of control as well.
So what do you think? What are you thinking about presenting to the legislature in question of these issues? What kind of
Every
questions
member
are
of
you
the
gonna be
General
bringing them
Assembly
up there?
has seen my projection, because I mailed it to them in November.
Yeah.
And I haven't given specific recommendations, but there are a lot of people out there talking about better ideas. I believe that there are many members of the legislature that are really thinking about consumer-oriented choice, that if we had more choice in insurance programs, that this might be a way of bringing down cost, because whenever you bring choice into a marketplace, you're able to do that. Another component of this is really driving toward wellness, which I think is really important.
Oh,
I mean, if
absolutely.
we don't have a system, and I'm not opposed to universal care. I think it's important for people to know that too, because if we don't find a way to cover everybody, at least with some basic program, we can actually see cost escalation in very high cost cases. So I understand the need to do that. I think there's better ways to get at it. I mean, we have 45,000 people in Vermont that are uninsured. We have one of the lowest percentages of uninsured people in the entire country. So you kind of wonder, what huge problem are we trying to solve with this billion-dollar approach? And of those 45,000, about 20,000 of them are eligible for Medicaid, but they don't sign up. You know, so really our real problem is down to about 25,000 people. Is it possible that the state of Vermont could go forward with a strong wellness program that would reach all Vermonters?
That's what I was going to say. What do you mean in your wellness program? What kind of
Well, I think we've got to really ensure that we have financial incentives for people to be well. I think that the cost of insurance and the cost of care should be gauged on how you treat your body. And if you smoke or you do drugs or you have, you know, there's something about your behavior and that you can control that will improve your health, I think you need to have a financial incentive or disincentive.
Right.
If you're healthy, I think you should get a financial incentive. Why shouldn't your health care be cheaper? Because frankly, you're not a burden on the system. If you're not well and you don't treat your body right, you should have a financial disincentive. This seems fair to me. And I don't know exactly what kind of incentives and disincentives could be put into place, but that's where I would go with it, because unless it's financial, people will never pay attention to it. It's all got to be about the dollar. It's all got to be about consumer response, you know? And I think the only way to drive people to be more responsible is if they feel that. And
Well, yeah, but okay.
there's evidence to suggest this works, by the way.
Well, wait, yeah, I was going to say, because the smoking thing, don't you
Yeah.
think the price of tobacco has just gone up so much that people can't afford it anyway?
Well, it's not a disincentive, though.
Oh,
People
right,
still
but
smoke.
one of the incentive, yeah, but one of the incentive things is getting your, if you're going to quit, getting your patches or getting whatever it is that would help you do that.
And there's so much help out there for people to stop smoking.
Well, the thing of it is
Vermont puts a lot of money into smoking cessation
right.
programs.
Well, I can say that I'm a smoker, but I've also tried like 6 times to quit smoking. It's something that just doesn't happen overnight, for me anyway.
Yeah.
Now, I like the idea of wellness because there are programs that would help people with wellness as far as like people that have chronic pain. There's programs for them, like Dartmouth has a wonderful one, the FRP program, which I went through. They also have chiropractors, which I think are covered now, right?
Oh, yeah.
And then there's 2 other things.
Chiropractors are an important part of wellness.
Right, but there's 2 or 3 other things that I can think of that is not covered. For one thing, like nutritionists. Another thing for people with chronic pain, too, that hasn't been covered is like massage therapy, acupuncture, hypnotherapy.
But I could tell you that, you know what, at some point, healthcare has become so expensive that unless the consumer has some peace in their healthcare, whether it's paying for some of those things out of pocket or having a high deductible plan.
But if you're looking at that being
Eventually,
helpful for somebody
yeah.
to get well.
Yeah, and maybe there's a piece for, you know, care to pay a part of it, but what's important right now is so many people right now, Linda, have health care that provides everything, first dollar in. They don't pay a thing for their health care. And when people are disconnected from it, that they don't pay anything, they sometimes become overutilizers of health care, and they don't have any skin in the game. Now, I'm not talking, you know, I know there's people that can't afford to spend a lot, but even people who don't have a lot of resources, if they even had to pay a $5 copay for the doctor or
They've
a
already
$10
got that.
copay for
They do already do that.
the ER,
Yeah.
there are some programs where they don't have to pay anything. Let me give you an example, how crazy our healthcare system is. A friend of mine who's a nurse said that she had a couple who were covered under Medicaid bring their baby to the ER. Now, the ER is a germy, nasty place. It's not a place where you should be bringing an infant unless they're really sick and
Yeah.
need emergent care. Brought this baby to the ER to get the baby Tylenol because the baby had a cold. Why? Because Medicaid will cover that ER visit 100%, where if they went to the pharmacy, they'd actually have to pay for the Tylenol. Is that nuts?
Yes, and not only
Okay.
that, but I think that the ER, it's just too easy for people to use it and abuse it. In other words,
But if there
go
were
there
a
for what it-
barrier to entry,
Right, but I mean, wouldn't an incentive be, okay, so if you've got a bad flu or something on the weekend, wait until Monday to see your doctor. So there, you don't have to, I mean, the premium thing, if you don't have to pay.
but if those folks had to pay
the-
$10 to go to the ER, not that they have to put their cash on the table when they walk in the door, but for some of them, if they're covered under public services, they could hit the EBT card when they could process it differently. But if they had to pay a $10 copay to go to the ER,
Yes.
they'd be thinking twice. Maybe I can wait till Monday and see my primary care doc.
Well, I've also seen the idea too is that they've got or they're thinking about this program, I guess, is that people on Medicaid or Medicare or whatever it is, if they utilize the emergency room so many times in a month, and that's where it should be. There's a limit on that, There's a limit on how many
I don't know how
times-
you can limit it because obviously somebody could have a trauma and they've got to go.
Well,
So-
yeah, right. No, but I mean, say if somebody's got 10 visits in a month and you're not legit, then they should have to. There should be a way that we can control that in some way.
We're kind of getting in the weeds a little bit about some of the solutions, but I think overarching wellness. And let me tell you what I think is important about this. Many larger firms in Vermont have what are called self-funded health insurance plans. It means that the company, whether it's Dealer.com or Vermont State Colleges or whoever it is, Fletcher Allen, they're self-funded programs. That employer is taking all the risk for their employees' health care. They may have a company like Cigna actually process the claims and all of that, but at the end of the day, it's the employer's responsibility for last dollar, okay? So if I'm an employee of one of those companies, I am usually it's a high deductible plan, I maybe have to meet my deductible, I've got some skin in the game, okay, but I've got real wellness programs going on. I have a financial incentive to be well if I'm covered under some of these programs. Those companies have been able to keep their cost increases for their insurance 3 to 4%, where Vermont as a whole has increased 8 or 9% in the same period of time. Why? Because they are really focused on creating this culture of wellness for their employees. I believe the state of Vermont can take those best practices of those self-funded companies and employ it to the whole state population, no matter who your insurance is, whether you're covered under Medicare or Medicaid or in a private insurance, and implement those strategies so that we can help everybody reduce the cost of health care and create a common sense environment that we're not bringing a baby that needs Tylenol to an emergency room. And so I think that there's got to be some ways to do that. Okay?
I can just see where you're going through with this whole thing about wellness and everything too. But what about the people that aren't well or can't be well? What about them? What about the
They
people?
need a lot of care.
Exactly.
And here's the problem with the system going forward. I've shown you, and I've told your audience, that this thing is going to cost a lot more than Vermont thinks. If the state of Vermont is faced with $300 million deficits year over year over year with this program, and I think my numbers are conservative, it may be more than that. What's going to be government's response to that shortfall? You tell me.
Well,
What is the legislature going to do about that $300 million gap? Where are they finding the money?
Well, they even said that, taxes.
And what
Spending-
else?
I don't know.
Cutting back the care.
Yeah. But that's
Okay,
just
so
it,
stop.
but they shouldn't
So
be.
stop. They're going to increase taxes to cover the shortfall, but it's not going to be the end of the day because the next year, there's going to be another $300 million shortfall. Eventually, and they know this even today, they're going to have to cut services. One of my biggest worries about this is not the cost and not what I'm going to pay in taxes. Yeah, that's a concern. And it's going to have serious impacts to the economy of the state. But one of the biggest concerns I have is that people that need regular care so they don't end up with a serious multi-thousand-dollar event, an expense to the healthcare system, won't get the ongoing personal primary care they need because the system is going to start to ration. This is going to eventually, which is why I think my numbers are conservative, going to roll into huge costs that will be out of control. And it's going to be very tough on people. And it won't certainly be the way we want to see our healthcare system perform in the state of Vermont. So there are a lot of downsides to where I think this is going to go. Not the least of which is the impact of the economy and tax rates, but the impact on people and their lives and their quality of health care is of paramount concern, and it should be to everybody who's listening to your show.
And you know, and I like the way you say that too. And I agree with you that I think there should be some incentive for people that are well, that can be well. Absolutely.
Yeah.
You know, like people like myself that smoke, you know, I need to really get a grip
You
on
quit
that.
smoking, lady.
Well, I was just going to say, you know, I have done that. I've tried 6 times, but never once do I ever say that I'm not going to try again.
Good for you.
And that I'm not going to succeed, because that's the way it works, you know.
You can do it.
You learn tools over time, you know.
Yeah.
I did. I quit for a year, and, you know, and went back, you know. But it was hard for me, though, not making any excuses, and my husband smokes, too.
Yeah.
So we have to do this as a couple thing together. But you're right, there are a lot of incentives out there to
And
do
it's
that.
never too late to quit.
That's right. That's it. And, you know, as far as being over somebody that's been overweight the majority of my life, I signed up for Biggest Loser the other day. So
Good for
who
you.
knows?
Awesome.
Maybe I'll get picked and I can really get well, you know? Because if you get picked for that, you have to quit smoking, you have to do all this stuff. You know?
Yeah.
But, and, you know, I think it's just, it's our own personal responsibilities to take care of ourselves. And we, as people, know what that means, to how we can do that.
Yeah.
We know how we know what we need to do and how we can do it. Did I just lose? No, I didn't. I thought that was...
You know, I was talking to my family doctor the other day, and I was telling him about, he knows all about this, and he completely agrees with me that this system could be leading to a financial disaster and result in physicians leaving Vermont and lower access and care, and he's very concerned about it. And I urge people who are listening to the show to talk about what this is going to mean. Ask your family doctor or your nurse practitioner what they think this is going to mean to you.
Yeah.
And if you want to see my financial projection, you can find it on a website, vthealthcarefreedom.org. It's vthealthcarefreedom, all one word, .org. And you can see it and look at it for yourself. But ask
Maybe
your
we can
doctor.
even put this up there on your...
Sure, it's right on my printout there, so you got it. But ask your doctor or your nurse practitioner what they think this is going to mean. Most of the doctors I know are very concerned. Their primary concern, you know, a lot of people who are all for this program are saying, well, doctors are being greedy. I don't know a single doctor that is greedy. They're worth every penny, and they don't get paid enough. And not in the North Country, they don't. And you know, they work a lot of hours. They have a huge education. They have a huge responsibility. They really care about their patients. But you know, I asked Tim. I said, Tim, if you were talking to your patients, he said he talks to them all the time about wellness. I said, what's the most important thing? You know, one thing he did tell me. He said, if they smoke, to quit smoking. So I would worry less about the weight based on what he said. Quit smoking first. That's the most. That was the biggest health risk because it leads to so many other things, and then maybe work on the weight issue next. But you know, I don't even think smoking and obesity is even our biggest problem in Vermont. You know what I think one of our biggest problems in Vermont is, and nobody wants to talk about this. It's drug abuse.
Oh, yes, I know.
And drug abuse leads to
especially prescription
so many medical
Yes.
issues and psychological issues that can't be cured.
Yep.
And if there was anything we could do to help our children, it would be don't let them get on that train.
If they do find help in substance abuse, you know, there's a program here, the Turning Point Club, that have programs for teenagers, for kids to go and to be together and know it's okay not to do drugs, you know.
Yeah.
It's so important.
Yeah.
So important.
But it's important for people to understand that we need to walk into these reforms with eyes wide open. There's a lot more we can do on the consumer side. Currently,
yeah.
Vermont has a great program called the Blueprint for Health, which is aimed at people with chronic issues to ensure that they're seeing their doctor on a regular basis so that they are well, so they don't go toward that catastrophic event,
Right.
or there can be an intervention before they get there. I think that's going down the right road of controlling chronic disease. Which is aiming toward wellness. It's the first stop on the wellness thing, but then there's more we can do beyond that. We're a population of 621,000 people in Vermont. We're a small group. Nationwide, when you look at healthcare groups, we're a small group. Why can't we corral that, bring the best practices of other healthcare groups and the self-funded employers who've kept their costs down with really great strategies, bring that into what we're doing in Vermont. Let's do those reforms first. Open up our insurance exchange so people have broad choice in what they can choose. Because if we don't do this, I'm afraid what we're going to do at the end of the day is we're going to really lose our social safety net that we have. I don't think we should expand it. I think we need to keep it small and keep it contained, but it needs to be there for people who need it. I fear that with this coming down the road, this is going to erode that as well, and is really a problem. It could be a very big problem for Vermont in the future.
Well, I know, Wendy, this has been a fascinating subject today, and I know we're down to the last few minutes, but I would like, if it would be okay for you to give the Walking Through audience a little message, maybe, what your personal feelings are about this whole issue.
Well, I think the most important thing, if somebody's watching this show and you have concerns about what this is going to be, I suggest you go on that website, www.vthealthcarefreedom.org. I believe that's it. Let me just double check vthealthcarefreedom.org. And if you have concerns about what you've heard today on this show, or what you might see if you look at that website and look at my projection, please call your legislator and have a discussion with them. Your legislator is probably going to be out on town meeting day, going to various town meetings. Make sure you ask them this question: how will this program be funded? How will you assure yourself it will not lead to huge deficits for the state of Vermont, which will harm our state fiscally?
Yeah.
Who will be covered? Who will pay? And how much will this cost? That's probably the most important thing. Ask those questions of your legislator. How much will this cost? That's the first thing. How much is it going to cost? And if they can't answer you, ask them how they will assure themselves and you how this is going to work out for the state of Vermont. And that it will not do no harm to at least the decent healthcare system we have today.
Right, because we don't want to mess with our doctors and all of that.
I hear you.
And Wendy, with the one thing I took also from what you were talking about too is wellness. And I think a lot of people, when they look at that, they're telling me I have to do this. But if you take it in context and you look at it and you say to yourself, you need to be honest with yourself before you can even think about getting well. You know, it's like
true.
People try to hide behind blinders, or at least I used to.
Yeah. Or they don't go to their doctor because they don't want to face the fact that they have heart disease or diabetes. You know, that's crazy.
Yeah, and if you go to the primary care and you talk to your doctor, you're going to prevent all this stuff that's going to come down the road. You know, you're going to be able to help yourself a lot better.
You bet.
So primary care, and I have a nurse practitioner, and he's great. So, Wendy, I want to thank you very much for coming, and
Linda,
hopefully
thank you for
you'll come
having
back.
me.
It was a
Be
good
happy
discussion.
to.
Yeah. Maybe we can get a group of people together and have like a little discussion that way.
I'd like to see a broad audience.
Yeah,
Put a bunch
we'll
of people together. Let's have a town hall on this.
Hey, I think that's a wonderful
Okay.
idea. We'll just get the Walking Through Life viewers out there to arrange it. I'm sure we can do that. So anyway, this is Linda Carbonell, and we're saying goodbye for Walking Through Life today. We'll see you next time. Bye-bye.
Some days I can move mountains, and other times I can't get it right. But every mountain that I'm climbing brings me one step closer. Raise my eyes to the morning, looking down a road that seems so rough. But if you ask me, I would tell you I still ain't had enough. walking through